Today we're laying out where you may be going after the hospital and the different steps and maybe what to expect in the coming months in regards to stroke recovery. Depending where you're at in your recovery, it may also give you some ideas of therapy services for you to seek out in the future. I'm Kailee. I'm a speech language pathologist, and my family's actually from Hawaii. And so I love the aloha spirit there, and I've created this channel to create a sense of togetherness and support. So welcome, I'm glad you're here. I've made it my mission to demystify stroke recovery and help you or your loved one know what to expect at each stage of recovery. I've also created free daily brain exercises to help you with whatever your needs are. So make sure to click the subscribe button to keep you in the loop. At the end of this video, my hope is that you will feel more at peace knowing what your options are and what lies ahead. Since your recovery happens in stages, you may be going to different treatment centers or places to get therapy services. I've worked in each stage of stroke recovery from the hospital to the home, and I love working with adults no matter what stage of recovery they're in. So today I'm going to highlight what your journey may look like. Now, it always depends on the type of stroke you had, right? Where in the brain you had your stroke and the size of the stroke. And some of these options may be limited depending on where you live. Each person's recovery journey will look different, and that may impact the different places you'll be going to get therapy. Let's consider stroke recovery as though it is a multi-level building, and we have staircases and elevators that go up to the very top, right? So our goal is to get up to the very top, which may be your most independent and safe self after a stroke, right? So all of these different treatment centers or places you may get therapy, say they're different steps in the staircase, right? So you'll go from one into the next and whatnot. So some of these places you may not need to go to depending on the type of stroke you had and how many changes you're having, right? So for example, say someone had a very large stroke, meaning a large part of their brain was affected by the stroke. We would anticipate that they would have a lot more physical changes and a need for more intensive therapy than someone who may just be experiencing some small changes after their stroke. So say the person with a large stroke, they may need to take each step and go to each treatment center to reach up to their most independent self. While someone else who maybe had a smaller stroke and aren't noticing as many significant changes, they may bypass some of those steps and take the elevator to the place that they need to be in their journey. So this is just a reminder that each person's journey looks different. I'm just highlighting what some of your options may be. So let's start with the first place, the ER, the emergency room. That's where most people's journey begins, whether you took yourself there, whether an ambulance took you. Usually most people end up in the ER, and that is where they start getting different assessments and tests and imaging done. We talked about this is where you would get a CT scan, kind of a picture of your brain to see if there's any bleeding there. And you may be there for a few hours, and then they would transition you to a different part of the big hospital. So the next place you would go is, if you were in really critical care, would be the ICU, the intensive care unit. So in this unit, it's usually, unit just means maybe the floor or the different section in the hospital. So the ICU has it to where their nurses are typically only taking care of 1 to 3 patients at a time. So they're really at your bedside tending to you. This would be people who are not medically stable yet. Once you are medically stable, then you would be transferred and moved to maybe a different area of the hospital. It depends on how large the hospital is, but sometimes they have a neuro floor, meaning this section of the hospital is designed for people who have brain injuries. So this is helpful because the nurses who are on the floor and all of the staff who are on that floor are very aware and equipped to help you in your brain injury and in that stroke recovery. This is where you might start to meet therapists. So this would be your physical therapist, occupational therapist, and speech therapist. And then you may also start to meet other people besides the nurses and doctors, such as the discharge planner. So this is a social worker or someone who is helping you know what the next step would be after the hospital. So they would be talking to you and your family about what to expect next. Typically, the next place in your stroke recovery journey is an inpatient rehabilitation hospital. This is typically a smaller hospital designed for rehabilitation. So you would be continuing to get 24/7 nursing care, and then you would also have a therapy team depending on what your needs are: physical therapy, occupational therapy, and speech therapy. The sessions are typically 1 hour each on weekdays, and some places do things differently on weekends. You might have a shorter session. Typically, you're having one-on-one sessions, maybe occasionally group sessions if you're all kind of working on the same thing. The typical stay is about 2 weeks in this hospital. Some hospitals have a standard of 2-week stay, and others, I worked in a hospital where I saw patients there for a couple of months. Depending on the type of injury you have, the progress you're making, it all depends on what the hospital policies are and what insurance is covering. Some places also allow family members to stay with you in a room on a cot, and some just have visiting hours. So I'd make sure to ask about that as well. And typically your days here are very full, so you may not be up for a lot of visitors because you may have a pretty packed day. This is all about intensive early therapy that will help in your stroke recovery. So after the hospital, you would go to your next home. Now, that might be a temporary home. Let me explain. So if you are still needing assistance with things like bathing or dressing or taking care of your medications or meals, then you may be going to what we might think of as a nursing home. There are 2 different types. There is an assisted living home. This is where you're primarily independent. In this setting, you would continue to get therapy either through hiring a home health agency for someone to come to you, or some assisted living centers have a clinic on site where you could continue to get therapy. The next place is a skilled nursing facility. The main difference with this is that you still need 24/7 nursing care. So that might be if you're continuing to get IV medication or wound care or something where you need a lot more assistance. In regards to therapy, they typically have a therapy team on staff where you continue to get therapy there. It's typically once a week. It can sometimes be up to 2 to 3 times a week. So with both an assisted living and a skilled nursing facility, you could be there temporarily, or it could be your new home where you continue to get assistance with those things, especially if family members are unable to help with those needs. And then the next option is that you are going to your home where you were living before. So for therapy, you have 2 different options. You can continue to get therapy of someone coming to you. That's called home health. So they have people who come to you. It's typically about once a week, and the sessions are about 45 minutes to an hour. It varies between companies, but they're typically once a week. The only thing I will say about this as well is that since you're in your home, you may not have a lot of the different equipment or resources that you will have seen in the hospital or in a therapy clinic. So that brings me to the next place you could be going if you are living at home, and that is outpatient therapy. So this is a clinic or a place that you are going for an appointment. It is typically 1 hour appointments, anywhere from 1 to 3 times a week typically. And then you would also see how many therapy services you need. For example, if you are getting physical therapy, occupational therapy, and speech therapy, you would be having an appointment for each one. So it just depends on what your needs are, but that is typically what you see in outpatient therapy. Those are some of the typical places you go after stroke recovery. There are a few more that I wanted to mention to make sure that you know about and know what your options are. Day Neuro is a place that is focused on rehabilitation and therapy with people who have had neurological injuries, so brain injuries. And in this setting, it is typically people who are wanting intensive therapy after. So it would be sometimes a half day or a full day where you go, and they typically have individual sessions as well as group therapy sessions. A lot of people that I see in this setting are those who may be younger and are wanting to return back to work, but anyone is welcome. I also know there are some really good home and community reintegration programs. So this is where a therapist would come to you and they would focus on trying to get you back to the things you were doing, getting you back into the community and finding a new schedule and rhythm for your life. Depending on where you live, I would look at different community resources. So for example, right now I'm in Dallas, Texas, and here we have lots of nonprofits that are focused on helping those who have had brain injuries recover. So for example, here we have a Brain Injury Network of Dallas, where it's a clubhouse or a place where all of the members can go, and they have a work order day, meaning they are doing different tasks. It's all member-led, and they are trying to spread awareness about brain injuries. And it's similar to an office in how they try to run things or have you complete different tasks and things like that. It's a really great resource. So I would look in to see if there's any sort of nonprofits in your area that help out with stroke recovery. Sometimes there are even gyms that are designed for those who have different physical deficits or difficulties and are recovering from a neurological injury. If you live nearby a university or a college, I would look to see if they have any sort of speech therapy program there where they are able to offer services. So for example, when I was a graduate student and learning to become a speech language pathologist, we had a clinic on site where I could see people there, and with the supervision of my different mentors, I was able to help them and learn and grow there. So that was a great thing that helped me along the way, and I was able to help others. Sometimes there are also groups or support groups that help with your progression. And then at home, you could also have private pay or concierge, where you pay someone who's coming to your home. That's typically on the higher end. And then there's also at-home maintenance, meaning you have the exercises that your therapist has given you and you're just practicing those daily. Whew. So I went over a lot of different options with where you can continue to get therapy services. But the main thing I want to let you know is where you go depends on a couple of things. One, how much assistance you're needing with basic tasks, how much of a change you're experiencing physically or cognitively, how much of a difference do you feel since your stroke. Then it will depend on what's available in your area, what your insurance covers, what you are able to do in your financial situation. If you live in a more metropolitan area, there are going to be a lot more resources than if you live more on the countryside. So I hope this was helpful in giving you a recap of all of the different types of places you could go to get therapy. I wanted to leave you with some key takeaways. One, make sure you know what your options are in your area and talk with your doctor about what the possibilities are. And then early and intensive therapy is the best predictor of stroke recovery. So that leads me to number 3. Usually the most therapy you can get and the most frequently leads to better, faster recovery. So I always say, if you have an option where you can get more therapy, go for it. And then finally, ask what you can be doing outside of therapy. So progress is made daily. I would ask your therapist what you can be doing outside of therapy daily to improve your recovery. We've covered a lot of different options today, and I hope you can see how everyone's journey might take a different path. Let me know in the comments what stage of recovery you're in right now. With stroke recovery, typically we see the most significant changes within the first 6 months of injury. So I always say try to make sure you can get as much therapy as you can during that time. And then we see a lot of changes even up into a year and beyond. After a year, you might be making some refining movements or some small changes with that, but it's always possible. I'm cheering you on. Remember, it's doing the right things consistently that bring progress. Make sure to check out the rest of my video series on stroke recovery, where I go in depth about different topics, and please let me know in the comments if there's something you'd like me to cover next. And if you're ready to get started doing free daily brain exercises with me, make sure to click subscribe so you're notified when I upload new exercise videos. I really thank you for being here and giving me your time. I appreciate it. Aloha. Have a good day.